So these are the arterial blood gas values. We already discussed that in the last class. pH is within the range of 7.35 to 7.45. The partial pressure of the CO2 is 35 to 45. As long as you know the pH, you know the CO2. The bicarbonate is 22 to 26. So now we are trying to analyze the respiratory acidosis. And we're able to discuss in the last class that pH is down in respiratory acidosis and CO2 is up. We said the lower the pH, the more acidic it is, the higher the pH, the more alkalotic it is. So if it goes below 7.35, it is acidosis. So pH is down, CO2 is up. And here we're given the values of pH being 7.30 and CO2 being 68. The normal range is 7.35 to 7.45. So this is lower than the normal range. So it is an acidosis, and we can see that the CO2 is also 68, higher than the normal value, and CO2 is supposed to be high in respiratory acidosis because of the retaining of that CO2. So if an individual has a respiratory problem where they cannot blow off that CO2, they are retaining it, hence retaining more acid, so they become, or they are put in a state of respiratory acidosis, and we can see that from these values. So in respiratory alkalosis, the pH is up and the CO2 is down. Alkalosis, the higher the pH, the more alkalotic the body is. So if it goes above 7.45, the body is said to be alkalotic or basic. And the CO2 is down in respiratory alkalosis. So if you can see the values here, we have a pH of 7.50 and a CO2 of 30. So we can deduce that this is a respiratory alkalosis, because knowing the normal range, the normal value of the pH, which is 7.35 to 7.45, this is above the 7.45. So this is alkalosis. As long as the pH is greater than 7.45, it is alkalotic. Then the CO2 is actually 30. The normal is 35 to 45. So this is lower than the normal range, lower than that 35. So this is a respiratory alkalosis. So in metabolic acidosis, we did say that here the pH is down and the HCO3 is down. So acidosis, pH is down because the lower the pH, the more acidic the body is. So look at the pH here, given the normal range, which is 7.35 to 7.45. Here, the value here that we have is 7.28, which is below that 7.35. So this is an acidosis problem. And the HCO3, the normal value is 22 to 26. Here, this is 18. So the HCO3 is also down. So this is a metabolic acidosis because the pH is down and the HCO3 is also down. So metabolic alkalosis, we said here the pH is up and the HCO3 is up. We have an example here. pH is 7.48. Which is higher than that 7.45, which that is an alkalotic problem. And the HCO3 is 35 and the normal value is 22 to 26, so it's higher than that value. So this is an example of a metabolic alkalosis where the pH is higher than the normal and the HCO3 is also higher than normal. So let's look at steps in analyzing arterial blood gas results. The first step on our list is identify if it is acidosis or alkalosis. So remember that we said that the lower the pH, the more acidotic the body is, the higher the pH, the more alkalotic it is. So we are going to identify this by looking at the pH, already knowing the normal value being 7.35 to 7.45. Then the second step would be to identify if it is a respiratory or metabolic imbalance. We are going to do that by looking at the CO2 first of all, then after that looking at the HCO3, because remember we did say that the CO2 is the respiratory function indicator and the HCO3 is the metabolic function indicator. So if you look at the CO2 and we deduce that this is not a respiratory problem, we can look at the HCO3 to see if it's a metabolic imbalance or metabolic problem. So we'll go more into that when we look at each step. So then the third one is identify if it is compensated, partially compensated, or uncompensated. I remember from the last class I did say that when one is out of balance, the other will make up by either increasing or decreasing in order to balance the pH. So if it's a respiratory problem, we have to look at the metabolic for the state of compensation to know if it is compensated, partially compensated, or uncompensated, but we'll go more into it when we look at each step individually. So from analyzing the imbalances, we can deduce that respiratory imbalances, the pH and the CO2 have an inverse relationship, because in respiratory acidosis, pH is down and CO2 is up, and the vice versa for respiratory alkalosis. So you can see that they have an inverse relationship. When one is up, the other will be down. Why for metabolic imbalances, the pH and the HCO3 have a direct relationship. In metabolic acidosis, we can see that the pH is down and the HCO3 is down, given the examples that we use to analyze that, and vice versa for metabolic alkalosis. So let's look at the steps in analyzing arterial blood gas results. When you are given the value of the pH, the CO2 and the HCO3, how are you able to identify if it is a respiratory or metabolic imbalance? First of all, let's look at the points to remember. Point you should always remember when analyzing arterial blood gas results, because if you remember this point, you'll be able to analyze any blood gas result. In acidosis, the pH is down. In alkalosis, the pH is up. The respiratory function indicator is the CO2. The metabolic function indicator is the HCO3, that bicarbonate ion. So talking about step one said we have to check if it is acidosis or alkalosis, and we'll do this by checking the pH. So here, given the normal values, pH is 7.35 to 7.45, so lower than that acidosis, higher than that alkalosis. So yeah, also let's look at the CO2. CO2 is 35 to 45, so means that, and we said that CO2 is equivalent to the acid. The more CO2 you have, the more acid you have. So that means if the value gets above 45, the body is more acidic. If it goes below that 35, that's the lower range of the value, that means the body is going to be more basic. Because of more of it, that means there's too much acid. And if it goes lower than 35, that means you are losing that acid. So what are you going to be left with? Base. Higher than that 45 is said to be acidic. Lower than that 35 is said to be basic. So also for the HCO3, the normal value is 22 to 26. So if it goes above that 26, the higher end of the value, it is more basic. The client is said to be retaining so much of that bicarbonate, so much of that base. So if it goes below that 22, that means the client is losing all that base. So what is the client going to be left with? Acid. We explained all these points in the first class. So here, if the pH is less than 7.35, it's an acidosis problem. Greater than 7.45 is an alkalosis problem. So let's look at this example. Let's identify if it is acidosis or alkalosis. So here the pH says 7.30 and the normal value is 7.35 to 7.45. So it is below that value, that's 7.35. So that means this is acidosis. It is below the normal range. And here the pH said 7.68, which is above the normal range. So that means an alkalosis problem. So let's look at the step 2. Step 2 says identify if it is respiratory or metabolic imbalance. So be looking at the basic concept method and the rule method. The basic concept method is you just understanding what goes on in these imbalances, which I discussed in the first video. As long as you know what goes on in these imbalances, you will be able to use this basic concept method in analyzing the arterial blood gas results. And the rule method, that's the method we've all heard. We'll be using the rule method in the next class. When we use it, you will come to realize that you already know the rule method. They are both easy method, but it doesn't matter what method you use to analyze this arterial blood gas results, as long as you can see it and analyze it. You see it in your exam or you see it anywhere, you're able to analyze it. You see your patient's blood gas results in the hospital, you're able to analyze. Let's look at this. The pH is 7.30 in this example, the PCO2 is 60 and the HCO3 is 25. You already know our normal values. Please have that in mind. So pH is 7.30, which is below the normal range. And once the pH is below the normal range, that is an acidosis problem, because the lower the pH, the more acidotic the body is. So we can deduce now that this is acidosis. So then we look at the CO2. CO2 is given a value of 60, and we know that the normal range is between 35 to 45. So we can say that it is this CO2 that's actually putting the body in a state of this acidosis. And remember that the CO2 is the respiratory function indicator. We already deduced that this is an acidosis problem by looking at the pH. Then CO2 is above that normal range, so meaning that the client is holding on to that CO2. That means the body is going to be more acidic. The more the CO2, the more acidic the body is. So we can deduce that this patient is in a state of acidosis because of that high amount of CO2, making the body more acidotic. So we can say this is a respiratory imbalance. So that means it's a respiratory acidosis. So the HO3 is 25, which is within that normal range, 22 to 26. So we can already see that this is a respiratory acidosis. So looking at the next example, we have a pH of 7.58. First step, identifying if it's alkalosis or acidosis by looking at the pH. You can see that the pH is higher than the normal range, so we're given a pH of 7.458, which is higher than that 7.35 to 7.45. So this is alkalosis. So now we can look at that CO2. CO2 is 25. Normal range is 35 to 45. So we know that the more the CO2, the more acidic the body is. And I gave an illustration saying that since the normal range is 35 to 45, if it goes above 45, that means the body is retaining so much CO2, hence becoming acidic. If it goes below that 35, that means the body is losing so much acid, and a value below that 35 is basic. So here we already deduced that this is an alkalosis problem. We can see the CO2 25. So we can say that it is that acid that the patient is losing, that CO2 that the patient is losing, that is leaving the patient with base. So putting that patient in an alkalotic state. Hence, respiratory alkalosis. So let's keep that. So then let's look at the HCO3. The normal HCO3 level is between the 22 to 26, and 22 here is the normal value. So let's look at this other example, pH 7.22, CO2 38, HCO3 21. So the pH is 7.22, it is below the normal range, so we can already say this is an acidosis problem. Then let's look at the CO2. CO2 is 38. We know the normal value is between 35 to 45. So the CO2 is within the normal range, so we know this is not the respiratory problem. So now let's go over to the HCO3. The normal value is 22 to 26, and the HCO3 is the bicarbonate ion, so it's lower than the normal range. So we can say that this is a metabolic acidosis because the client is losing all that base. If the client is losing all that base, what's the client left with? Acid. I'll give that illustration where I said that if it goes higher than that 26, that means the client is retaining so much base. If it goes lower than that 22, that lower end of the normal range, that means the client is losing base. And if the client is losing base, what's the client left with? Acid. So we can say it is this HCO3 of 21 that is putting the client in a state of that acidosis, hence metabolic acidosis. So now let's look at the next example. pH is 7.58, CO2 is 42, HCO3 is 38. So the normal range of the pH is 7.35 to 7.45. This is higher than that, so this is an alkalosis. Now let's look at the CO2, which is 42. So it's within the normal range, so we can say this is not a respiratory problem. Let's go to the bicarbonate, that HCO3. The value here is 38 and the normal range is 22 to 26. So this is higher than the normal range. That means we can say the client is retaining so much base, putting the client in that alkalotic state. So the client is retaining so much bicarbonate ion, hence becoming more alkalotic or more basic. So we can now deduce that this is a metabolic alkalosis. We can say it's that bicarbonate that the client is retaining that is putting the client in that state of alkalosis, hence metabolic alkalosis. So mostly you see that the ones that have the problem is the one that will be abnormal. For example, respiratory acidosis, you see that the CO2 will be abnormal, while the HCO3, that's the other one, will be normal. But it doesn't always follow this pattern, because we can ask that what if the CO2 and HCO3 are both abnormal? What if both of them are abnormal? What if the pH is normal and the others are abnormal. Well, these examples we've given so far are examples of uncompensated imbalances. So step 3 is to determine the state of compensation, whether it's compensated. You can see compensated as fully compensated. They both mean the same thing, whether it's compensated, uncompensated, or partially compensated. So we already talked about that when there's an imbalance. I said that in the last class, that the other would either increase or decrease in order to steady that pH. And we said one makes up for the shortcoming of the other. So if there's a respiratory imbalance, that's a problem with that CO2 that is controlled by the lungs, the kidneys will come to compensate with the HCO3, that's bicarbonate. In theory, if the pH is within the normal range of 7.35 to 7.45, then compensation or full compensation has occurred. So if it is not a full compensation or is not compensated, you have to look at the CO2 or the HCO3 to determine the state of compensation. So if it is a respiratory imbalance, look at the HCO3 to determine the state of compensation. And if it is a metabolic imbalance, you have to look at the CO2 to determine the state of compensation. Remember, one makes up for the shortcoming of the other. So let's say it's a respiratory imbalance. For example, you've determined a respiratory alkalosis. Now you have to look at the HCO3 to determine the state of compensation. If you look at the value and see that the value is abnormal, that it is not within that normal range, then you can say it's a partial compensation. Also, if you now look at the HCO3 and you see that it is normal, that it is within that normal range, then you can say it is uncompensated. So we said all this in theory. Let's look at examples and see how well we can make sense of all this. And we'll also be using the basic concept method in determining the state of compensation. So look at this example. pH is 7.32, PCO2 is 68, while the HCO3 is 47. So pH of 7.32 is acidosis. Just by looking at the pH, we can deduce that. Then let's look at the CO2, 68. It is higher than the normal range of that 35 to 45. So we can see that the client is holding on to that CO2. So we can say it is a CO2 of 68 that is putting that body in a state of acidosis. So we can say here that this is a respiratory acidosis. So let's look at the HCO3, 47. So that doesn't correspond with that pH of 7.3 to the acidosis. So yeah, we can say that this is actually a respiratory acidosis. Let's look at HCO3 to determine the state of compensation. It's a respiratory imbalance. So look at the HCO3, which is 47, higher than the normal range. You can see that the body saw that it was acidic or had so much acid and decided to compensate by increasing the amount of base, that's bicarbonate, in the body to balance up that pH. Look at the pH to see if the compensation was complete enough to bring the pH back to normal. So the pH is not within the normal range, 7.32. So we can say this is a partial compensation. So hence, partial compensation respiratory acidosis. So let's look at our next example. pH is 7.50, CO2 is 55, HCO3 is 40. Looking at the pH, you can say this is alkalosis. Then look at the CO2. Let's determine if it's respiratory or metabolic by comparing it to the pH. CO2 of 55 does not correspond with that alkalosis problem. So now let's look at the HCO3. HCO3 is 40, the normal range is 22 to 26. So we can see that this client is retaining so much base, and that alkalotic state, that alkalosis. So comparing it to the pH, we can see that it is that HCO3 of 40 that is putting the body in a state of alkalosis. So we can deduce that this is a metabolic alkalosis. So now let's look at the CO2 to determine the state of compensation. Since it's a metabolic imbalance, let's look at CO2. CO2 is 55. So we can see that the body recognized that it had so much base and tried to compensate by increasing that CO2 to balance up that pH. So now let's look at the pH to see if the compensation was complete enough to bring the pH back to normal. So the pH here is 7.50. So that is not within the normal range. So we can say this is a partial compensation. Partially compensated metabolic alkalosis. So let's look at this example. pH 7.38, CO2 48, HCO 332. So looking at the pH is within the normal range. So how are we supposed to determine if it is alkalosis or acidosis? Because this is not a situation of lower than the normal range or higher than the normal range. Well, there are two ways we can deduce this, because definitely there's an imbalance going on here. First of all is by knowing the patient diagnosis. Let's say you know your patient came in with vomiting. So you can look at that HCO3. HCO3 is 32. So we can deduce that with that elevated bicarbonate, your patient is already in metabolic alkalosis. Or if your patient came in with a respiratory condition, let's say for example COPD, you look at that CO2, which is 48. So with that elevation of CO2, you can see your patient is in respiratory acidosis because of that retaining of CO2. The second way you can know this is by knowing the acidic side / alkalotic side. Here, the normal range is 7.35 to 7.45, but there's something we call the lower end of the normal value, and there's something we call the higher end of the normal value. 7.35 to 7.39 is still the lower end of the normal value, so that is still going to be said to be acidic. Why 7.41 to 7.45 is at the higher end of the normal value, so those values are said to be alkalotic. So now, having analyzed that, we can say 7.38 is acidosis. Let's look at the CO2 48. It is higher than the normal value, so we can say that is a CO2 of 48 that is putting this body in a state of acidosis. Because CO2 is higher than the normal value, meaning that the client is retaining all that CO2. So we can say this is a respiratory acidosis. Let's look at the bicarbonate 32, higher than the normal value. That doesn't correspond with that acidosis. So since you've deduced that this is a respiratory acidosis, let's look at the bicarbonate still for compensation. So bicarbonate is 32. So we can say that the body recognized that it had so much acid, then try to compensate by increasing that bicarbonate to steady the pH. So let's look at the pH. Let's see if the compensation was complete enough to bring the pH back to its normal value. So the pH is 7.38. I will know the normal value is 7.35 to 7.45. So we can say this is a compensated or fully compensated respiratory acidosis because the pH was brought back to normal. So let's look at the next example. pH is 7.45, CO2 is 49, HCO3 is 38. So this pH of 7.45 being at the higher end of the normal value, we can deduce that this is an alkalosis. Now let's look at the CO2. CO2 is 49. This doesn't correspond with the alkalosis problem. Let's look at the HCO3. HCO3 is 38. The bicarbonate is elevated. So we can say that it is the HCO3 of 38 that is putting this body in a state of alkalosis. That is what making the body more basic. So we can say this is a metabolic alkalosis. So now we've deduced this is a metabolic imbalance. Let's look at the CO2 for compensation. So the CO2 is 49, elevated, higher than the normal value. So we can say that the body recognized that it had so much base and had to compensate by increasing that CO2 to balance up the pH. Let's check the pH to see if the compensation was complete enough to bring the pH back to its normal value. So looking at the pH is 7.45, which is within the normal range of 7.35 to 7.45. So we can say this is a compensated or fully compensated metabolic alkalosis because the compensation was complete enough to bring this pH back to normal. Looking at this example, pH of 7.10, we can already say that this is a state of acidosis. Let's look at the CO2. CO2 is 60. So the normal range is 35 to 45. So this is above the normal. So we can say it's a CO2 of 60 that is putting this body in a state of acidosis. So hence we can deduce that this is a respiratory acidosis. Let's look at the HCO3 for compensation. So we have deduced that this is a respiratory acidosis. Looking at the HCO3, you can see the HCO3 is 23, which is within the normal range. Normally, the HCO3 is supposed to have been increased in order to balance up that pH, to balance up the acidosis. But here, we can see that the HCO3 is still within the normal range, so there was no compensation. So this is an uncompensated respiratory acidosis. Let's look at the next example. pH 7.35, CO2 is 32, HCO3 19. So a pH of 7.35, we can deduce that this is acidosis. So now let's look at the CO2. CO2 is 32, the normal range is 35 to 45. So this value of CO2 does not correspond with the acidosis problem. Look at the bicarbonate, which is 19. The normal value is 22 to 26. So we can say the bicarbonate here is reduced, meaning the client is losing that bicarbonate, and when the client is losing that bicarbonate, that base, the client is left with acid. If it gets above that 26, that means the client is retaining that base. It's going to be more alkalotic. But if it goes below that 22, then the client is said to have acid, because the client is losing all that base, hence being left with acid. So we can say that a bicarbonate of 19 actually corresponds with that acidosis problem. So we can deduce that this is a metabolic acidosis. Let's look at the CO2 for compensation. Normal range is 35 to 45. We have a CO2 of 32. So we can say that the body recognized that it had so much acid and tried to compensate by reducing that CO2, that acid. Let's see if the compensation was complete enough to bring the pH back to its normal value. So the pH here is 7.35, which is within the normal range of 7.35 to 7.45. So yes, the compensation was complete enough to bring the pH back to its normal value. So we can say this is a compensated or fully compensated metabolic acidosis. Thank you for staying to the end of this video. Please do let me know what you think about this video in the comment section, and do not forget to like, subscribe and share this video. I hope that at the end of this video you're able to really understand how to analyze arterial blood gas values, and I would advise you do some practice questions so you lock it in. You know what I'm saying? So till me again, bye bye.